Exactly 1 month ago, we held the first hearing in a decade on examining America's mental health crisis. Our discussion underscored how multidimensional the issue is, touching on factors including gaps in healthcare coverage, stigma, structural inequities, and workforce supply. The COVID-19 pandemic only complicated and exacerbated this long-standing crisis, causing increases in social isolation, anxiety, and workforce burnout, all of which compounded and heightened existing collective mental health conditions. During today's hearing, we will take a deeper look at the interrelated mental health issues: substance use disorders, overdose deaths, and suicide. These are somber issues that affect each and every one of our communities. I was very pleased, and we were able in the 115th Congress to pass bipartisan support legislation called the SUPPORT Act, which made progress in combating the opiate crisis, including policies like adding opiate treatment programs to Medicare providers. While the legislation was a step in the right direction, data tragically show that more work must be done to help those who are indeed suffering. In 2020, more than 40 million people over the age of 12 struggled with a substance use disorder. That same year, as the COVID-19 pandemic cast its shadow over our nation, the United States set a record high 100,000 overdose deaths. Sadly, suicide rates also remain at historic levels. America has the highest suicide rate of any wealthy nation, nearly double the rate of the United Kingdom. During last month's hearing, we spoke about the stigma around mental health issues. That's a conversation that we intend to continue this morning. The history of substance abuse disorders in the U.S. is one marked by, again, stigma, criminalization, and a lack of recognition that these issues are health conditions requiring evidence-based treatment in the same way we treat diabetes or hypertension. Without necessary mental health treatment and supports, millions of Americans face severe illnesses, addiction, incarceration, and death. Due to longstanding social and economic inequities, historically marginalized groups in the United States face particularly bleak outcomes. We must finally take on these issues in a serious, holistic manner. It will take all of us working together to address this often invisible suffering across many communities. Fortunately, the White House also recognizes the need for urgent collective action. I'm grateful and very pleased last night during his State of the Union address that President Biden announced his strategy for addressing the nation's mental health challenge. Together, we can build on the foundation we laid in the American Rescue Plan to ensure that everyone who needs mental health care is able to access it. Today's hearing is an important step in tackling the problem. Testimony today will help to inform the legislative action that the committee will take this year to address some of the long-standing problems in a way that we deliver and access mental health services across our nation.